Great. Hi, everybody. My name is Zara, and this is the Headache Relief Blueprint. So today we're going to talk about how to prevent headaches and migraines in this hour-long talk, followed by 30 minutes of question and answer. So throughout the presentation, if you have questions about what I'm saying, feel free to type it in the Q&A, and I'll get to it at the end. So it's really nice to kind of meet you. My name is Zara. I am an occupational therapist with an undergrad in neuroscience and psychology. I've been working in neurological rehabilitation with chronic conditions for the last 5 years. I have a special interest in chronic fatigue syndrome, chronic pain, post-concussion syndrome, long COVID, these conditions that tend to be chronic and impact your life in so many ways, right? And most people in this clinic have these kinds of conditions. Today we're going to talk about one of the symptoms of them, which is headaches. And I also have a personal recovery from ME/CFS and fibromyalgia. I had these symptoms for 10 plus years, was able to make a full recovery, and I absolutely believe recovery is possible. I believe functional gains are possible, and I feel very hopeful and optimistic about this. And if you take any of my classes, I go into like a lot more detail about the story, but I'm not going to go into that because we don't really have the time for that today. Nonetheless, I do believe recovery is possible. I don't want to promise it for every person, but I'm much more optimistic than you might hear from some people. Okay, let's talk about headaches. So first of all, we're going to talk about tension headaches and what they are, and then we're going to talk about migraines and different theories for headaches, and then I'm going to get into tangible things that you could do even today, like even later today, some things that you can do to help manage your headache. So a tension headache is typically mild to moderate pain, tightness, or an ache through the head on both sides usually. And it's usually caused by tension in your neck or shoulders. You might even be able to recreate the pain by pressing into your neck in certain areas and feeling that tension that's caused. Some theories about headaches, especially if we're thinking about the headaches that are present in these kinds of chronic conditions. Some of the various things that we think might be happening is a triggering of the trigeminal nerve. This is specifically for migraines. People have a sensitivity in this nerve, and we'll talk about how that can be important for treatment later. Sympathetic activation and nervous system dysregulation. I talk about this a lot. This is a key element in a lot of these kinds of conditions. So with these centrally sensitized conditions, often the amygdala is hyperactive. So your fear center is overactive. You have too much sympathetic activation, or so much so that you kind of go into freeze mode. Or there's dysregulation of the autonomic nervous system. Your vagus nerve is not supplying as much stimulation as it needs to the organs that it regulates, meaning that there's more tension, reduced blood flow, hypoxia, so not enough oxygen to different areas in the body, vascular dysfunction. This can all come from that dysregulation piece. So regulating the nervous system is an important part of headaches. We will touch on that a little bit. I have an entire course on that if you wanted to ever learn more about nervous system dysregulation, but we'll skim the surface of it today. Inflammation is another thing that can cause headaches. So if you're not familiar with the term, we can have inflammation in our brains. So we have glial cells in our brains. They are basically the cleanup crew. They help us when we're injured, or if you've had a concussion, or when you have these kinds of conditions. If they overproduce, then there's too much cytokines or inflammatory molecules. That inflammation in the brain can sometimes cause headaches. So reducing inflammation is a big part of reducing headaches, which we'll touch on a little bit today and much more in depth in the brain inflammation course. Hormonal imbalances can also cause headaches. That is something to be considered, and this is why it's important to think about these mind-body approaches: the nervous system dysregulation, the brain retraining, the diet and lifestyle factors. Those are all really important, but it's also super important to be assessed with a medical team that can rule out things like hormonal imbalances or serotonin um, imbalances. There's various things that can impact these headaches. So it is important to work with a professional who can maybe give you medication and help you kind of figure out what's going on. So these are some of the theories. There's way more things that can cause headaches for sure, but this is like when skimming through the research and checking things out, these are the main theories in these conditions of what's causing headaches, as well as that, muscular tension sort of picture. So there's a difference between a tension headache and a migraine. What I've seen over the last 5 years of practice with lots of people with headaches is that it is very, very often that migraines are misdiagnosed. And there's a problem with that because migraines are treated very differently than tension headaches. So the medication that we use for migraines is a lot different than what we would do and the approaches that we would do for a tension headache. So a lot of people have intense headaches, and just the intensity itself is enough for a doctor to say, oh, you're having migraines. But you might not actually be having migraines. Migraines are usually triggering of the trigeminal nerve, and there's a chemical cascade in the brain that happens that has a lot to do with like CGRP and stuff like that. I'm not going to get into the crazy neuroscience stuff about it, but um, the migraines have this chemical basis and this really inflammatory basis. So there's a different kind of treatment. So it's important that if you are actually having migraines, that they're diagnosed properly. Migraines come often with nausea, a sensitivity to light or sound. Migraines sometimes they'll have an aura. You're not going to have an aura before a tension headache. So an aura is like um, I have a friend who sees sparkles before she has a migraine. So you might kind of have a bit of an auditory or visual hallucination, like a like light flash or sparkles or something like that, that you have prior to the migraine. That's called an aura. That's a pretty good sign that it's probably a migraine. Pain on one side of the head. So migraines are not bilateral. If you're having pain on two sides of the head, it's less likely that it's a migraine. Not that I'm allowed to diagnose anything, but this is just sort of what we see and what we know. The pain with a migraine is on one side of the head and it's pounding or throbbing. So if your pain is consistent and it's like this consistent ache, it might not actually be a migraine. So migraines have an aura sometimes, not always. They're intense, severe pain. They're pounding or throbbing, and the pain is on the one side of the head. Those are very different from a tension headache, which can still be severe pain, depending on what's going on and depending on how much tension there is. But the tension headache is more global. So it kind of can feel like your head's in a vice grip, or you can get, across the forehead, or, there's more jaw pain associated, neck pain associated, that kind of stuff. The thing where it gets the most diagnosed is when people have severe tension headaches or neuralgias. So, for example, like occipital neuralgia is basically like an inflammation or a pinching of your occipital nerve, which comes up from behind your neck, or the base of your head goes up into and behind your eye. It's called a ram's horn pattern. That can be excruciatingly painful, but it's not a migraine. It's different, right? It's a nerve that is influencing this headache. That's not the trigeminal nerve, so it's not a migraine. So it's a different kind of treatment for that. So having someone really parse this apart for you can be really beneficial in being able to treat it well. If it is in fact a migraine, then these are some of the things that can be really helpful. These are also going to be helpful for tension headaches too. And I will separate some of the treatments that are helpful for migraines versus tension headaches, but these are what we call the migraine recovery strategies. It's called SEEDS. So SEEDS for success. The first one is sleep. So getting 7 to 8 hours of restful sleep by setting a routine, creating your comfortable sleep environment, limiting your screens before bed, all the typical sleep hygiene stuff. I've done presentations about sleep. We talk about it a lot in the Inflamed Brain course, but getting more refreshing sleep can help with migraines. So, really looking into what could be supportive for that, because a condition of these disorders is often unrefreshing sleep, right? Exercise. So, I know this is going to be a bit of a challenge for some of you, but thinking about what can you do within your energy envelope that would get your heart rate up and that would get some blood flowing through the body. That's the idea that we want to do. We're going to talk about this a little bit more, about ways to move to get the blood flowing through the body that aren't necessarily exercise. But when we look at studies, they found that 20 minutes of exercise that gets your heart pumping 3 times a week is preventative for migraines. Of course, that might not be possible for you, so do what you can within your energy limit and do what you can within your, functional tolerances to get your body moving a little bit. Adding gentle practices like yoga is also a great idea. Eating, so our diet really impacts, especially with migraines, because there's this inflammatory piece with a migraine. So, a low inflammation diet, lots of leafy greens, veggies, whole foods, fiber, variety of fiber is really important because that feeds your gut bacteria in a specific way that creates more short chain fatty acids, that creates more serotonin in your brain. So, we want to feed the gut so we can feed the brain and have that reduction of headaches potentially if there's that serotonin piece going on. Your gut does produce 90% of your serotonin, but it can't make it up into the brain. So that endogenous serotonin that your body produces doesn't cross the blood brain barrier. But when you eat fiber and your gut bacteria, this little microbiome that lives in there, digest that fiber and then they produce short chain fatty acids, those will make serotonin and dopamine and other kinds of neurochemicals. So it is a good idea to have a variety of fiber, meaning different fruits, nuts, vegetables, seeds, that kind of stuff. You also want to think about what foods might be triggering. If you have migraines, a lot of people have triggers, and identifying the trigger can help you with your understanding your migraines better. There is an app called Migraine Buddy, which it can help you identify your triggers. So things like chocolate, coffee, yeast, cheese, artificial sweeteners, red wine. Those there's in each of those are different kinds of chemicals that are sometimes triggering for people with their migraines. So just being mindful of what you're eating, and if you have, a migraine every time you have a diet pop, that might be your trigger, and it might need to be eliminated for a while. Dehydration, so 6 to 8 glasses of water a day is what's recommended in the seeds, but more recent research says 10 cups in the first 10 hours after waking. And it's not like you at 4 p.m. you're like, oh, I didn't drink much water today, I'm just gonna chug this thing of water. But throughout the day, consistent water is important. So every hour having a cup of water so that you're getting consistent hydration. That is much more important than just chugging a bunch of water at the end of the day when you realize you forgot. So, whatever you can do to remind yourself to get that consistent water, that will be helpful. Stress. Stress can help with tension headaches and migraine headaches. Nervous system regulation type stuff is a really good thing to look into for that. And we're going to talk a little bit about that later in the lecture. In terms of triggers, so we mentioned coffee and chocolate. Alcohol is a trigger for some people. Sometimes skipping meals, stress, bright lights, scents, weather, and lack of sleep. This is one thing you can do is identify your triggers and then try to avoid them as much as possible. But another thing you can do is something like pain reprocessing therapy or nervous system regulation, exposure type therapies. These will all have components of exposing yourself to your trigger in small increments and then regulating your system, and training your system to see it not as a trigger anymore. So just like triggers for PTSD or triggers for phobias or anxieties, we can retrain our triggers, right? We can help the nervous system understand that the weather patterns changing is not dangerous, or that, bright lights are not actually dangerous. But that takes some repatterning and some retraining, which is totally possible to do. And I'll give you some resources near the end of the lecture that can support that. So, one of the ways that we can start to retrain the system is by retraining your breath. This is so important for headaches because when we're not breathing properly, it not only does it dysregulate your nervous system further. So, if we're not breathing well, our nervous system becomes more dysregulated. But if we're not breathing properly, we're not actually using the diaphragm as much as we can to take a deep breath. So you're using the accessory muscles. So you're using muscles in your neck and your shoulders to like heave up your lungs rather than using your diaphragm to do the job that it's designed to do. And we breathe 22,000 times a day on average, most people. That's a huge number, right? Imagine doing 22,000 reps of an activity, of a weight training that your body wasn't designed to do, right? So if we're not breathing from our bellies, we're not using our diaphragm to breathe, your body is doing this incredible work up through the neck and shoulders. So of course you're going to have headaches. Of course it's going to be hurting in that area. Of course you're going to, touch your traps and it's going to feel super tense because, your body's like doing all this exercise it's not meant to. So retraining your breath, I know it sounds like kind of an eye roll thing, like, another practitioner is telling me that I need to breathe differently. But just hopefully you can appreciate why this is important just based on what I just said. So how do we retrain breathing? First of all, we slow it down. So most of us are breathing too quickly. And if you notice that you're the kind of person that we call it gallops, you gallop in your speech, you talk like this and you don't take space to breathe. And that could mean that you're used to not breathing slowly. So slowing it down, right? 4 to 6 breaths per minute is like our resting, relaxing rate, which is way slower than you think it is. So the way we can slow our breathing down is by pausing at the top and the bottom. And this just signals to the nervous system that we're safe, right? So we take an inhale, pause, then exhale. Pause, then inhale, kind of thing, right? You might have noticed when I did that breath that my exhale was longer than my inhale. That's because our exhale controls our parasympathetic nervous system. There's a like relationship between our exhale and our parasympathetic nervous system, which is rest and digest. So if we have a longer exhale than an inhale, it will actually help to relax the body. Whereas if you have a longer inhale than an exhale, your body will become more stressed, right? When we're stressed, when we're scared, we go, right? Or we like have like a more of a long inhale. So if you're like hanging out with someone who's having a panic attack and you're like, oh, just take some deep breaths, take some deep breaths. And they're like, that's going to make them feel worse, right? It's not about taking a deeper breath. It's about having a slow, soft breath with a long exhale. That's what's going to soothe the system. So we can retrain our breath to do that. We also want to try as much as we can to breathe in through our noses when they're not blocked. Breathing in through your nose supports your immune system. Interestingly enough, we produce more nitric oxide when we breathe in through our nose. So the nitric oxide boosts your immune system and it also regulates your nervous system. So highly recommend when you can, if you can, breathing in through the nose. How you breathe out doesn't really matter. You can breathe out through your nose or your mouth, whatever you decide. Then the diaphragm. So I would say like 90% of my clients don't really breathe from their diaphragm when I first assess them for this. So you can even check out with yourself right now, like, am I breathing from my diaphragm by putting your hands on your belly and noticing if your belly is moving out on your inhale and back in on your exhale. So if you check it out, is that belly moving? And if not, that means you're probably using your accessory muscles. You're breathing what we call apically from the top of the lungs, and you're using your neck and shoulder muscles to pull up the lungs. So retraining yourself to breathe with your diaphragm. And if it's really hard at first, or if this type of breath makes you feel a little bit dizzy, I would recommend practicing it lying down, because when you're lying down, your diaphragm doesn't have to work against gravity, right? When you're lying down, it's just easier to take a deep breath. So practice it in laying down if that's easier for you. You can also practice with like a book or a very, very low weight on the area of the diaphragm to practice. Like, it's a muscle, right? So if you give it a little bit of weight, that can also help to build the muscle. And this is something you kind of want to think about throughout the day that would help with lowering that stress level and lowering the physical level of tension in your body. We can also think about our body's position. So our body is built to support itself, right? But our lives and technology is like really influencing the ability of our body to support itself. When our neck is a bit forward, it puts way more weight on our spine. So understanding your posture and your ergonomics is quite important for, not putting extra stress or unnecessary stress on your muscles. I would say that the actual stress of the nervous system is probably more important than your ergonomics, because, we all know somebody who like sits like a crumpled up piece of paper on the couch and is not in any pain. So it's not like there's a direct correlation between ergonomics and your pain, but it is one of those things that can help. So just be mindful throughout the day of your posture. And when I'm thinking about posture too, I'm also thinking about the nervous system in the back of my head, because when we're in crumpled up postures, it's more of this like protective posture, right? You're communicating to the nervous system you're not safe, and that's going to further the dysregulation of the system. So opening up your posture is nice for your joints and your muscles to be able to support your body, but it's also nice for nervous system regulation, because an open posture is a way of communicating somatically, I am safe, which is helpful for reducing that dysregulation of the nervous system. Our phones are so bad for our postures, right? We're all sort of just like double chin looking at the phone. Our necks are squished, and it's not a great position, really. So be aware of where your phone is. Maybe hold it up a little higher so your chin can be supported. We just really, that forward head posture, it just puts a lot more tension on the neck muscles. And if you already have sensitivity in those muscles, like your nerves are already quite sensitive in that area, it's just gonna, more tension is just gonna aggravate it more, right? So be aware of your posture. Be aware of when you're on your phone that you're not fully in neck flexion, forward head position all the time, and that maybe you hold your phone higher, you hold your phone further away from your face. We're actually supposed to hold our phones at arm's length from us. I just learned this a couple weeks ago and I was like mind blown. I was like, what? I've been holding my phone so close to my face. But the iPhone came out with this like health thing. You know how they have the, if you're listening to music too loud, they'll give you a little warning that says turn it down. They now have one for your eyes. If your phone is too close to your face, they'll recommend that you hold it away from your face, at least a foot or two, maybe even more. So because when it's really close, we can get nearsightedness, and we can also lose our peripheral vision, which like because we're tunnel visioned on the phone, which increases our nervous system dysregulation too. So the way that we interact with our phone can be, um, make headaches worse, basically. Also, it's recommended from a lot of people in headache worlds to avoid stomach sleeping, because what happens is when you sleep on your stomach, your neck is like totally, squished to one side. So think about side sleeping or back sleeping. That's going to be better for your neck position. You can also think about a special pillow. There's tons of neck supporting pillows on available online. So feel free to take a look at that too, because your sleep ergonomics, especially because we're sleeping for a long time, like 8 to 10 hours a night. That's a long time to be in a certain position. So thinking about supporting that position better can be something that can be useful. Or a posture corrector. If you find that your posture is really poor throughout the day, you can get one for like $30 and it's like kind of like a backpack with no pack. It just pulls your shoulders back and allows you to have that, better posture. Movement as well. So whether or not you can exercise doesn't, like, yes, it would be great if you could get your heart rate up. That will help prevent especially migraines, but position changes are important. So if a lot of you are, bedridden, or you're spending a lot of time in bed or a lot of time at home, every once in a while, like every if 20 minutes, if you can, honestly, moving your body a little bit. So that doesn't have to be that you're getting up and you're walking and you're like exerting yourself, but a little bit of a gentle stretch, or just moving your body in any kind of natural way, because we really need to get that blood flow. We mentioned the hypoxia theory before, how there's not enough oxygen moving through the body. Blood flow can help with that, and we really get into just like locked into tension when we're not moving. So even if it's just reminding yourself to sort of gently move throughout the day and to twist a little bit and to stretch a little bit, that can help just kind of like move things through the body. Walking if you can. If you are going to go for a walk, try to dedicate some walking time to not holding things in your hands. Because when we hold something, especially if we're like holding it up, then we don't have arm swing with the walk. And with headaches, it's helpful to have arm swing with your walk, because then you're getting this nice movement throughout your shoulders. And when your shoulders are moving, again, you're kind of bringing more blood flow to that area. So swinging your arms when you walk can actually, I mean, you don't have to exaggerate it. You don't have to be like skipping along, but just having a natural arm swing will help bring more blood flow to that area. And then we already talked about exercising within your limits, but if you can raise your heart rate a bit and then lower it again, you're going to get that extra bit of blood flow. We also want to think about keeping body tension low. Every single one of us has patterns of tension in our body that we carry. We all do. It's part of being human. And you can kind of check in with yourself right now, like, where do you hold tension? So do you hold tension in your stomach, in your hips, in your jaw? Some people curl up their hands into fists when they're starting to feel tense, or some people kind of wear their shoulders like earrings, right? Like, where do you hold tension? What does that look like for you? And then you can kind of just check in with the amount of tension in your body throughout the day. So it sounds weird. I know this is gonna sound a little strange, like when you're in a yoga class and they're like, breathe with your hip or whatever. But actually thinking about breathing into that space of tension can help to relax it. Let me prove it to you. Um, so what I want you to do is make this as hard as you can. Just like really squeeze your fist really, really hard. What do you notice happens to your breath? So for most of you, probably, when you're squeezing your fist like that, you hold your breath. It's normal to start to hold the breath when you're squeezing a fist. Now what I want you to try to do is keep that fist squeezed, but take a really nice slow breath, like the Sun breath. Notice what happens to the fist. So as you take a deep breath, especially if you kind of imagine like breathing into that area, it's likely that that tension is going to start to go down. And the more breaths that you take, the harder it is going to be to hold that tension. So it's the same thing with tension in your body. imagine breathing into that area is not just a silly yogic term, it's actually really helpful for releasing tension. So imagine breathing into that area. You can also add more tension to relieve tension, which sounds weird. But like, so for example, if you have a lot of tension in your shoulders, tense them more. So tense them up to your ears, hold it for a second, and then release it. And notice the difference between the tension and the release. Sometimes giving a little bit more tension will allow the muscle to then let itself release. Notice if there's certain situations where tension becomes higher and then plan for that. Like if there's a person you always talk to that makes you tense, plan for that when you're meeting up with that person that, okay, I'm going to intentionally try to keep my shoulders low when I'm talking to my stepmother or whatever, I'm intentionally going to try to make sure that my hands are nice and loose when I'm in this conversation. So that's something you can do. You can also think about holding a muscle too. So like holding the belly of a muscle. So let's use your traps as an example. The middle of the muscle, you can kind of just like hold it and not massage it. You can massage it if you want, if that feels good and helps relieve your tension. But a myofascial release is to just hold the muscle and to breathe. And eventually, sometimes that little like bit of feedback that the muscle is getting will allow it to sort of just kind of melt under your hand. There's also guided body scans and progressive muscle relaxations and things like that. I just started a YouTube channel that is going to have a bunch of this stuff on it. So I'll give you the link for that at the end. And then, yeah, the belly breathing will help keep the body tension low as well. So to release muscles, think about a ball or a roller or a cane. It could literally be like a tennis ball, right? You don't ever want to do something that's more than like 6 out of 10 pain. You don't want to cause pain that your body is then, crunching up over or like really reacting to. You want to have a little bit of sensation. So if it's too much for you to lay on a ball, then you might like put one up against a wall and kind of lean into it a little bit. Or, a roller, or there's like something called a theracane, which you can kind of just put over your shoulder and get into the muscles a little bit. But it can be nice to feel like you're releasing the muscles. A massage gun can be really helpful. And then 2 areas people don't think about a lot, but actually are quite tense when you have a headache are your eyes and your jaw. So not everyone is going to have tension in these places, but a lot of people will. So one of the things that you can do when you have a headache, and people do this naturally, they kind of go like this, right? They like rub their forehead. But actually intentionally relaxing your eyes, so softening your gaze, which means like when you're looking at something, so sort of just imagine the muscles in your eyes softening as if you're like, you don't have to intensely focus on that thing, but you can sort of soften your muscles. Or a technique that I super love and use probably every day is like rubbing your hands together to make them warm and then holding them over the eyes. And you can kind of be like a cat making bread and, press one and the other, press one and the other, or you can just hold or gently sort of press around the orbital bone. So around this, like, what would be the circle in a skull. And notice how that impacts the system just by relaxing your eyes a bit. Relaxing your jaw. So there are some tongue exercises that can help you relax your jaw. Make sure you check in with, a medical professional before you go trying any new exercises. But for example, if you run your tongue from the top right back tooth, that was a lot of descriptors, but the top of your back right teeth, and run it across your teeth all the way to the top of the back of your left side, and then again on the bottom left to the bottom right. That gives you a pretty full stretch of the jaw, which can feel really nice. Manual release can be really helpful too. So either like kind of gently massaging on the outside, or you can get a physiotherapist or an osteopath or something like that to show you how to manually release from the inside. Because sometimes if you get like right behind your teeth and can, use your finger to release the muscle from the inside, that can also be sort of just like an instant relief of headaches and things like that. So maybe finding a YouTube video or getting a physio to show you how to do the inside manual release can be super helpful. But releasing the jaw can be a nice way to release headaches. If you find you're waking up with headaches, it might be that you're clenching your jaw in the middle of the night. So sometimes a mouth guard or maybe doing a hypnosis before sleep to release the jaw can also be useful. So, in summary, for that section, 4 things to focus on throughout the day. Your posture, right? How are you sitting up? How is your body supporting itself? Your breathing. Are you breathing from your diaphragm? Are you breathing slow? Are you kind of aware of your breath? Movement. Are you moving enough within, even within complete bed rest, you can still have little bits of movement in the body, little bits of like moving the shoulders around and moving the neck around. And then are you doing some things to actively relieve tension? So those are 4 things you can think about throughout the day. And then in terms of rewiring our attention to this pain, because if you've had headaches for longer than 3 months, what's happened is that your nervous system is now sensitized to those headaches. So the nerves in the area, your neck and your head, are going to be probably more sensitized. They're called nociceptors, and they're probably going to have more sensitivity. So basically, a little bit of pressure is going to feel like a lot of pressure. And then the amygdala is more sensitive too. So it's reacting to these headaches and to this pain, as if something is really, really wrong. So reinforcing safety is a really, really good tool for these kinds of headaches. So you can use the tool of somatic tracking. This is a big part of pain reprocessing therapy. And I'm going to give you some resources to check that out in the end. Somatic tracking is basically observing the pain of these headaches with mindfulness. Headaches were one of the worst symptoms that I had. Aside from the fatigue and other body pains, but headaches were pretty brutal for me. I had them almost every day for many years, and I don't really have them anymore. And this was one of those tools that made a huge difference for me. Because I think what happened when I was experiencing my headaches was like my brain kept going to something's horribly wrong. Something's wrong. I got to protect this. Like there's something in my neck that's messed up, right? And this tool helped me to be like, no, 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 it's safe. It's okay. This is literally just my nervous system has turned up the dial on this pain, right? It's like I have a hearing aid in and somebody's talking at a normal volume, but I've turned up the volume on the hearing aid so they sound louder. The stimulus itself is not loud or dangerous, but my brain and the nerve in that area has turned it all the way up so it feels way, way, way worse than the actual tissue damage because there's probably not tissue damage. I mean, of course, you want to get it checked out and make sure there isn't, but in most cases, it's more this sensitivity piece rather than actually something damaged that needs protection. Because if you don't need protection in your neck and head, it's totally safe to move it around. It's totally safe to you know, um, put weight on it, put pressure on it. But your body is saying, no, no, don't move it, don't touch it. Your body is producing pain to try and protect you when you don't actually need that protection. So just being mindful of it, objectively describing it. Yeah, there's a lot of pressure right now. I can feel a lot of pressure where my head meets my neck, right? Instead of being like, I'm being stabbed. This feels like a vice grip. This feels like 1,000 needles. I'm being tortured. None of that, right? Just it's pressure. It's tingling. There's a location to it. It's moving around and just allow yourself. So give yourself permission to feel it. I know you're like, I feel it every day. I do feel it. No, no. but allow yourself to feel it without trying to suppress it or change it or avoid it or like intensely watch it. Because that's what happens, right? We're like, oh, I have this headache and I'm not gonna be able to do this, this, and this is gonna turn into a full-blown migraine. It's gonna be horrible for a week. Let's see if we can pull back from all of that and watch it with curiosity and interest and maybe even a little bit of indifference. So it's almost like you're watching fish in a fish tank. It's not the most interesting thing in the world. And you don't really care if the fish go up or down. We're not so concerned with that. So it's like just getting curious. You don't have to control it. You don't have to work hard at it. You just have to kind of be with it in a different way. So that starts to retrain the brain. Safety reappraisal. So saying, yeah, it hurts, but it's safe. This is a safe signal. It's misinterpreted. I don't have to live in fear of this. It's like an alarm going off, but there's no fire, right? It's like my dog is barking at everyone walking by and none of them are dangerous. So it just reinforcing that there's safety instead of danger and that these sensations are largely harmless. Of course, if you've already determined that they are, right? We don't want to ignore something that's not harmless, but if you've determined that they are, we're reassessing our relationship to those sensations so that we can turn that dial down. And then positive affect induction means to smile or laugh. Pendulation is finding what feels good. So switching to something else in the body, because at any given time, even when you have a headache, you have other sensations happening in the body. So one of my favorite things to do is to feel my hands or to feel my feet, especially the feet because they're far away from your head. So notice what's happening in your feet when you have a headache, because what this does, it's like your brain's a bit like the algorithm on TikTok or Instagram, right? What you engage with more, if you watch an entire video, if you like a video, if you comment on a video, your algorithm will show you more things. It'll be like, oh, you really like monkeys, so here's a million videos of monkeys. You've commented on 3 monkey videos on how funny the silly monkeys are. We're going to show you more monkeys, right? What's basically happening is you're teaching the algorithm of your brain to pay so much attention to headaches that your brain is like, I am so interested in headaches. Next time you have a headache, you're going to be able to focus on it even more. I'm going to show you so much content about headaches now because you've engaged in it so much, right? So what we're doing with pendulation, we're showing the brain that we're interested in other sensations in the body. We're saying, I don't want my entire feed to be monkeys. I would like to pay attention to other things, right? So in pendulation, you're able to switch to say, there's a positive sensation as well. But this is a pendulation, which means it goes back and forth. So we're not ignoring the unpleasant sensation. We're not ignoring the headache. We're not suppressing it. We're not trying to get rid of it. We're noticing there's something else good or pleasant or neutral that's happening in the body, sitting with that for a while, and coming back and tending to the pain with the somatic tracking. Noticing something good, tending to the sensation again. So it's not about just being like, oh, I'm not going to pay attention to this pain, because we can't suppress or avoid anything. It doesn't work. So it's more about changing the relationship to how we are paying attention to it and noticing that there's other things to pay attention to as well. So feeling safe, lowering your sense of threat. You can do this with, regular meditation. You can do this by reducing pain behaviors. So pain behaviors are things like bracing. So for example, if you're having like lots of, tension in your shoulders and stuff, and you're trying to reach for something, you like brace, right? Your body is like engaging all these muscles it doesn't need to engage to reach for something. So noticing if you're bracing, noticing if you're wincing, if you're like moaning, groaning, swearing, this kind of stuff, it can be helpful for acute pain, and it can be helpful in a moment of trying to express pain and express a need. But if we get into a habit of these behaviors, then again, it's sort of like the algorithm situation. Relaxing eyes, we talked about already. Vagal stimulation. So this is like doing things that get your ventral vagus nerve activated. And we talk about this a lot in the nervous system reset course, like so many different strategies you can use. So that is something to consider. But a few is horse breath. So we inhale, exhale, you flutter your lips like a horse, or gargling. A hard gargle a couple times a day can start to stimulate that nerve and get you into more of that state of relaxation, which can help with the headaches. Yawning, and cold exposure to like cold showers and a splash of cold water sometimes can be really, really good for headaches. Soothing sensations, heat, you know, doing like smelling something that smells good, right? Mint has a very profound impact on headaches. We'll talk about that in a minute here. Um, just engaging with mindfulness and meditation, or engaging in something fun and meaningful. So a big thing that I talk about with my clients and talk about in a lot of my courses is the importance of fun. It is something that's stripped away from you in chronic fatigue and chronic conditions. And engaging in fun is so important because it increases your endorphins. Your endorphins are your body's little natural pharmacy. It's your body's natural painkiller. So if you can do things that make you laugh, that make you smile, that are semi fun, and you can adapt activities to your activity level, but thinking about engaging in fun is something my clients don't even think about sometimes because it's so far away from, they're like, I just got to survive. My like rehabilitation is like a full-time job. I don't have time for fun, but I'm telling you, fun and laughter can be part of your rehabilitation. So that's something to consider as well. Reducing inflammation. Again, we get into this in great detail in the inflamed brain, and we also get into the joy thing in great detail in the joy class. We've talked about diet a little bit, finding the right type and amount of exercise, and then we're going to talk about supplements and medication too, because I don't want to breeze over that. But lights as well. So there are some interesting studies that show that like the red light or warmer light frequencies can be like more gentle for the brain. So if you're feeling a migraine or headache coming on, switching to warmer lights, red lights, orange lights, that kind of stuff, that can help the brain for sure. And then in the evening, having red light instead of blue light from screens, or like harsh overhead lights or the LEDs or something like that can be a little harsh. So considering the lights that you have can be helpful for headaches. Other sensations. So one time a couple years ago, I started looking up a peppermint oil thing because I was curious about peppermint oil. I went down this absolute rabbit hole. Like, I don't know, I was probably like hours of looking into studies about peppermint because it was so fascinating to me. I'm like, how is this so potent? Like topical peppermint oil, or smelling peppermint too. There's actually quite a bit of evidence that it's supportive for reducing headaches. I have some right here actually. um, and it's part of it is that our nerves are nociceptors, right? So the nerves that communicate these signals to the brain that your brain will interpret as pain, they're called nociceptors. Their job is to detect chemical changes, pressure, and heat. And what is peppermint? What does it do when it's on your skin? It's cooling, right? So it's interrupting, it's the opposite of heat. It's activating the nociceptors in a different way. And that activation of the nociceptors, if you imagine your nerve like an elevator, then let's say the signals that typically go up the elevator from the nerve all pile into the elevator. There's 20 signals piling into this big elevator. But if you interrupt that and you put 10 signals that are peppermint from that nerve, then as much of the signals from that area can't get to the brain, so your brain is not going to produce as much pain. um, so that's why topical peppermint oil or eucalyptus or icy hot or tiger balm or those kinds of things work, because it partially blocks the pain signal. This is the same reason why if a kid falls, you would maybe kiss the injury, right? Like if they have a bruise, you might like give a little kiss, because that soft touch interrupts the signal, because you're getting a soft touch rather than the pressure from the injury, the bruise. So rubbing above or below where it hurts can sometimes interrupt the signal, especially above where it hurts can interrupt the signal. Vibration too, or heat. So play around with what works for you. Some people really like cooling masks or a cold cloth on their forehead, but just playing around with what works for you. There is some good evidence for cryotherapy, which is cold therapy. So like having, an ice pack or something. They actually sell like migraine caps that have like it's like a little freezer bag, but it's a cap that you can put on your head. So that's worth exploring for some people. So we're kind of winding down here, getting into other tips. We talked about the warm or cold compress, sometimes a bath or a shower if you can tolerate that. Um, Fresh air, especially right now. Now's the best season, the shoulder seasons, or like, winter when it's a little cooler. It's a really nice time to step out into the fresh air and have that influence your mind a little bit. Changing your environment, so lights and smells, understanding what triggers you and kind of working around that. Self massage or massagers. There's lots of lots and lots of choices for that online. Yoga or Feldenkrais. So if you're like, I don't know how I'm supposed to move and get movement in my body and that kind of stuff, Feldenkrais is a really good way to move the body. And anyone can do it. It's very, very low impact. So I recommend checking out Feldenkrais if you're looking for a movement practice that could fit within anyone's energy envelope. That's definitely a very, very gentle practice, and it's a nice way to connect to the mind and the body. Eat regular meals. Skipping meals can sometimes cause headaches. A lot of people get headaches when they're fasting and stuff like that. So that's just if you choose to fast as one of your methods of treatment, then just expect that a headache could be possible. We talked about the water. And then there are options for trigeminal nerve stimulators for migraines. So there's devices that can stimulate the trigeminal nerve, which give it different feedback. And some people report there's actually some pretty good studies for those kinds of devices and how they can support headaches. And sometimes vagus nerve stimulators as well. Mixed evidence on the vagus nerve stimulators, but a lot of like clients that I've had report that they're really helpful. In terms of medications, so some people recommend like, non-steroidal anti-inflammatories for acute treatment, but they're really not meant to be used long term. So sometimes I see a client and they're taking like Tylenol or Advil every single day, and Tylenol or Advil taken more than 15 days in a calendar month will cause headaches. So many people don't know this. And when I tell clients, they're usually like, what? They're usually shocked with this information, but it's called a medication overuse headache. And taking Tylenol or Advil, or ibuprofen more than 15 days in a calendar month will cause headaches. So if that's the case, you need to talk to a doctor for a different kind of pain management, a different kind of medication, because that could be part of the picture. That could even be the whole problem, right? So it is important to know. Um, so in terms of migraines, there's prophylactics. So these are things that you take every day, things like amitriptyline, for example, or mirtazapine. Um, those prevent migraines. And then there's also a class of drugs called abortives, which can be taken if you have less frequent migraines. And these are taken, again, I think less than 10 times in a month. When you have a migraine, you take it, and it's supposed to help the migraines stop. So this is something to think about. Low-dose naltrexone can help with reducing the inflammation. That's something that I know Dr. Arsenault recommends frequently. Yeah, so another one that's really useful for a lot of people that's kind of, at least since I started in the last 5 years, has become a lot more popular is called CGRP. So the CGRPs, they have less side effects than the prophylactics and abortives, so people tend to do well with these. I'm not a doctor. I put this slide here just because I think that holistic healthcare is really important. So the things that I recommended are sort of more in my wheelhouse. These are things that you would talk to a doctor about. In terms of supplements, again, always consult with a doctor or pharmacist before you take anything. Nothing is benign. These are substances that are going to impact your system. So be very careful with what you put into your body. Don't just order something because you saw it on this presentation. Definitely make sure there's going to be no interactions with other medications you're on, or counter indications, like for example with DHA and EPA. This is like omega-3s, but if you have heart conditions, not recommended. So you want to make sure someone who knows your health history is making sure that it's safe for you to take something before you do. But these are some of the supplements that are recommended in the headache world. Magnesium bisglycinate or taurate can help reduce muscle tension. PEAK can help with inflammation. DHA, EPA, this is omega-3s, not omega-3 6 9. Don't get that, just omega-3. We get enough 6 and 9 in our diet. But this can help with reducing inflammation, which is a big part of the headache picture. Acetyl L-carnitine is known to help with reducing pain. For migraine specifically, the big ones are coenzyme Q10, B2, feverfew, magnesium, and omegas. And then creatine is something that has been recently studied for headaches. There's some promising research that is sort of in very new phases, but is interesting. It's pretty low side effect profile for creatine, except for like bloating. So yeah, thinking about that. Oh, and circling back to the magnesium, don't get citrate. Citrate doesn't cross the blood-brain barrier, and it's going to give you a tummy ache. So they use citrate when people are blocked up to help them eliminate their bowels. So unless you need to do that, I would probably not take citrate. I would take bisglycinate or taurate or threonate. Yeah, so that's supplements. Other things you can consider, again, hormone, blood sugar, thyroid testing within functional ranges, right? People say like, oh yeah, if you have an iron level of 20, that's normal. But that's not functional. You're going to be really tired if your iron is that low, right? So our normal ranges are not functional ranges. So think about consulting with a doctor, like an internal medicine specialist, like, Dr. Arsenault, Dr. McKay, or a functional medicine specialist or a naturopath who can actually do functional range testing for you. Acupuncture can be helpful sometimes for headaches. Massage can be helpful. Physio or kin to strengthen the muscles in your neck, especially if you've had like a whiplash or something. That's a good idea. Prolotherapy or trigger point injections, these are usually available through pain clinics, and there's lots of great pain clinics in the Lower Mainland and across the province. Botox, nerve block injections, SGB, again, usually available pain clinics. There's going to be a presentation on Botox. I'll tell you about that in the next slide. Pain reprocessing therapy, this is what I was talking about before. So I'm trained in this, and you can find other people trained in it by going to their website. And it's an awesome therapy. There's really, really promising evidence for this therapy. The book, The Way Out, the podcast, Tell Me About Your Pain, and the app Curable all talk about pain reprocessing therapy, but this is certainly something that can be really useful. And then clinical hypnotherapy can be really useful too, especially if you're like clenching your jaw or there's stress or trauma related to your headaches. That can be worked through in clinical hypnotherapy. That's something I'm trained in as well. So you're more than welcome to reach out to me for either of these things. There's a migraine special lecture with Dr. Ravi Danoa, and from the Muscle MD clinic, where they're going to overview the migraine treatment and Botox. Talk about that a little bit more, so you can look forward to seeing that soon. And to work with me, or if you have questions that you don't feel comfortable asking in a group format like this, then please feel free to email me. That's my email there. If you want to work with me, you can check out my website. And if you want some free content, I just started a YouTube with a bunch of meditations on it. TikTok, Instagram. You can get a bunch of free content there. And then I do group clinical hypnotherapy sessions every other week. So those are $15, and you can join them virtually online by searching me on Eventbrite. So now we can open it up for questions. We have 30 minutes for questions. I will take a look at the Q&A and we will get started with that. Okay, I'm going to try to get through as many of these questions as I can. There's 42. So let's see. Are headaches a sign of early PEM before a full crash? Yeah, they can be. So headaches can be one of your early signs. Tension can be an early sign. It's a really good idea to figure out for you and your body what are your personal signs before. I don't like to use the word crash, I'm sorry, but before an ebb or before an episode, so that you know sort of what is meaning that you're about to go into that space. But yeah, headaches can be one of the symptoms for sure. Um, there's a question on here, but I'm not sure what it means, so I'm going to skip that one. So someone was saying they have new daily persistent headaches, so they've had a headache 24/7 for 9 years. The pain is constantly at 7 to 9 out of 10. They've tried everything and then some. Any ideas or treatments you can think of? Wow, that sounds awful. I'm so sorry to hear that. It sounds like it would be really just debilitating in so many ways. I think that some of the things from this lecture would be really helpful, but the thing that I would probably highlight the most is the pain reprocessing therapy, whether doing that with me or another practitioner, or listening to that book, or because what's happening with a headache that is 7 to 9 out of 10 every day for 9 years, and if you've explored other things, like it's not, you've had an MRI and you're aware that it's maybe not something structural in the brain, then it's probably that sensitized nervous system, and learning how to turn that dial down will be the most supportive thing, I think. Feel free to reach out to me if you want. That sounds awful. I'm so sorry. Someone was asking, why is vascular dysfunction under nervous system? Because our nervous system controls our cardiovascular system. So if our nervous system is dysregulated, that means that your heart rate might be dysregulated, and your blood flow might be dysregulated as well. So that's kind of why that's there. Can tension headaches trigger a migraine? Yeah, absolutely. So, tension can trigger migraines for sure. Migraines have a lot of different triggers, but certainly that can be one of them. Often when I see clients that have migraines, they have a combo of migraines and tension headaches. Is throbbing, pounding on both sides considered a migraine or tension headache? So typically with a migraine, it would be on one side only. Of course, there are outliers to every rule, right? But that's typically, we would see a migraine headache just on one side, and it would be throbbing headache. I'm just going to read this kind of longer question. I wonder if Dr. Arsenault might answer this one. Dr. Arsenault, are you there to answer one of these questions? I can read it to you.
It is renewed something which you said it.
Go ahead.
Can I read this question to you?
Yes.
So this person is saying, I'm 30 and a cis woman. I've had headaches as long as I've had long COVID. I'm on LDN and LDA. I recently found out I'm deficient in testosterone and DHEA. If my pounding headaches are caused by hormonal imbalance, is there a way to treat it without going on HRT or exogenous testosterone, or is hormonal treatment effective when it's the cause?
I'm afraid I know nothing about hormonal treatment. not trained in that area.
Okay. Yeah, fair enough. I don't know either. If I mean, yeah, I mean, I know that our nervous system can impact our endocrine system, so nervous system regulation type stuff might have some impact on it, but I would maybe want to talk to an endocrinologist about the best treatment for that then. Thanks, Dr. Arsenault. Someone was asking I think if the aura can include lights, visuals, swirling colors, crystals shaped like visuals, and only eye pain. Yeah, yeah, absolutely. There's different kinds of migraines, and some of them are just ocular, meaning just of the eyes. Someone's asking what are different types of fiber? So nuts, grains, fruits, veggies, that kind of stuff. Can you have a migraine and tension headache at the same time? Yes, you can. Can a migraine be diagnosed with a CT scan of the head? This kind of an interesting answer. So an MRI can sometimes detect changes in the brain that are common with migraines, but migraines aren't diagnosed through imaging. They're diagnosed through the symptomology. So someone was saying if migraines are related to quality of sleep, is taking a Gravol tablet to regulate sleep a good trade-off? I read that Gravol shouldn't be taken long term. Yeah, I wouldn't, it's not meant to be taken long term. I would really focus on sleep hygiene. I would really focus on the things that you can do to manage better sleep, maybe supplements or talking to a doctor about other kinds of sleep medication. It's similar to like taking Advil every day, right? Like if we just that's not what it's meant for. It's not its intended purpose. So it's better to chat with a doctor about what would be appropriate to help support your sleep. But I'm always a proponent of managing our sleep hygiene really well first and getting really good at that and then trying that kind of stuff. Okay. Just reading through these questions here. So someone was saying that they are upset that I was promoting exposure to people who've learned what to avoid. So when I'm talking about exposure therapy, we're not talking about sort of throwing you into the deep end. We're not saying like go and just like expose yourself to your triggers because that's not going to be helpful. Any kind of exposure therapy is very slow and gradual and involves a lot of nervous system regulation. So it's not about doing things that are going to stress the system or like really activate the system or really cause your headaches. It's about very slow exposure with lots of safety reinforcement. Oh, someone asked me to repeat the morning water intake. So yeah, it should be about 10 cups in the first 10 hours of waking, like a cup an hour basically, with the frequency being important. Someone asked me to repeat the term Ramshorn. So, occipital neuralgia is a neuralgia of so like an irritation of your occipital nerve. And typically, the pattern of that kind of headache goes from the base of your head at the back up and around your head and behind your eye. That's the pattern of that nerve. That's the like where the nerve goes. It's called a ram's horn because it's like it's like a ram's horn. It's like a sheep, the way the sheep's horn kind of curls up and in. And that's different from a migraine. Yes, it is like a nerve-based headache. And not for that kind of thing, proper assessment and diagnosis from a pain clinic, and then treatment, often with like nerve blocks and stuff, can be really helpful. So this person was saying that they've read MSG is not the cause for migraines, but every time they eat something with MSG, they get a migraine, often that lasts for days. Yeah, and then they were saying that some people have told them that the MSG migraines are in their imagination. I'm sorry that you've been shamed like that, and that's not really fair. I haven't looked into the latest data on MSG and as a migraine trigger, but anything can be a migraine trigger. Like literally anything. Just like anything could be a fatigue trigger, anything could be a PTSD trigger, right? So just know you and your body, and whatever you've determined your triggers are, that's totally valid. Someone said they always awaken with a headache, which wanes by noon. So sometimes when you're waking up with a headache, it might be this like that you're sleeping in a really funky position, or it might be that you're clenching your jaw at night. That could be part of it. Oh, this is okay. Yeah. I'm glad that someone brought this up because I didn't consider this. So someone was saying regarding walking without holding something, what should someone do who's dependent on a walker or rollator do? So you're absolutely right. You would have to kind of keep your arms up to hold the walker or rollator. So you might want to practice then when you're not walking, just like gentle movement of the shoulders back and forth. The idea is that you're just getting more blood flow to that area and moving your shoulders around. So if you can practice that in any way, that's helpful, I think. So So someone said that in someone else's session, they mentioned keeping their BPM below the anaerobic threshold, which she said was about 60% of your max heart rate. How do we keep this in mind when trying to increase our heart rate when exercising? So I'm not sure that I would be so specific to say that you need to keep your heart rate below 60% of your max heart rate. When I'm working with pacing, we work with the individual and sort of what causes symptoms or what doesn't cause symptoms. So I work within the realm of green, yellow, and red zones is what I think about. So red is like PEM where you can't recover right away and it takes some time and it's like you're having increased symptoms for a long time. And then yellow is when you have moderate symptoms. So if you're increasing your heart rate and you're having moderate symptoms, but you're able to kind of come back from that pretty quickly back to your baseline, that's actually okay. We want to challenge the system a little bit. That's totally fine to do. So yeah, I would maybe not be so prescriptive in my approach, but everyone has kind of different approaches. And I would say to be more intuitive and listen to, is this a red activity for me to push myself too much with my heart rate? Or is this yellow? Right? Where am I at with that? So that you're actually listening to your system and getting that feedback so you know what kind of exercise and what level is good for you and your system. Someone was saying it's hard to sleep on their side because their arm goes numb when they put weight on it. What's the best arm position for side sleeping, considering back sleeping is also not advisable with sleep apnea? And then they also ask, could there be something else going on with my arm? It's worth getting checked out. Like if your arm's going numb, you might want to look into that a little bit. There's also some like pillows and stuff that can like have little notches in it to support your shoulder better or to support your arm better. So you can explore different kinds of ergonomic pillows and supportive pillows that might be useful to support the arm. There's also mattresses that have like a little dip for your arm. So there's all kinds of ways around that. But yeah, I maybe get that checked out. So someone was saying arm swing doesn't happen when you are walking the dog. I would just switch the arms that you're holding unless you have two two big dogs then yeah, just move your shoulders at different times of the day. But yeah. Someone asked, how do you do a hypnosis to release the jaw? So if you look up hypnosis for jaw on YouTube, there's tons of videos there that will be able to guide you through that. Someone said waking up with a burning pain in the top left side of the head and side of the face. Any ideas? That's something I would probably explore with a doctor or neurologist for sure. I'm not sure what that would be without like a more thorough medical investigation. I can't really make diagnoses either. Someone was saying that there's a like face massage and reflexology technique. It sounds like it's called Kanrenbui, Kanrenbui, with specific pressure points around the eyes, skull, and traps. That sounds nice. Can oversleeping cause headaches? Yes, sometimes for sure. So someone was saying who's supposed to do all this testing, right? No family, MD, neurologist, gaslight. Yeah, so it depends. There's some neurologists that are awesome, right? And then there's some that don't even actually have that much information about headaches because maybe they work in other kinds of neurology. So I think getting in with a headache clinic or a pain clinic can be a really nice way to get supported in that way. And then in terms of the hormone testing and stuff like that, endocrinologists do hormones, functional medicine specialists, internal medicine specialists might have more awareness around that stuff. Usually with those kinds of specialists, it's covered. And then sometimes you can also do naturopath as well. Someone was asking about stabbing pain behind the eyes. I might look into something called an ice pick headache. Maybe chat with a doctor about that. I'm just kind of going through the questions here. Someone was saying they tried a migraine hat and it triggered bad vertigo. And then it's same thing happened with cold plunging. Cold, especially cold on the top of the head, triggers something called the mammalian diving reflex. And it's a type of stress in the body. So it's like hormetic stress. So if your body's already super stressed out and not able to regulate from stress well, then adding that extra bit of stress can cause dysregulation, which can sometimes cause the vertigo. So it just might not be the right tool for you. Someone was asking about deep breathing and hernias. I'm not really sure about that, if it can make it worse or not. I haven't really read anything about that. Someone was saying they had a lot of success with HOV and Ubrevely. Those are CGRPs. So CGRPs, I think, can come both in injections and in medication form. And yeah, a lot of my clients have tried lots of things, and the CGRPs are definitely the things that work best. Someone asked about magnesium malate. I don't know about magnesium malate. I haven't really heard much about that one. Usually I recommend bisglycinate. Well, I recommend you talk to your doctor or pharmacist about bisglycinate or taurate.
Yeah. Change Pain Clinic uses malate.
Oh, okay. Someone asked about the inflamed brain group, if I'm doing it again soon. Yeah, we do them every 6 weeks. And then someone mentioned that with the hormone imbalance, it's really important to consider like menopause and perimenopause. Yeah, absolutely. And sometimes if you have like a major stress that has caused your ME/CFS or like even a virus like long COVID, sometimes that can cause an early menopause too. So that's something to think about too. Someone asked if the medication to help on an as needed basis to stop the migraine as it comes, those are called abortives. So they're called, usually they're triptans, so like sumatriptan or something like that. Someone is saying, what about ear pain? They get ear pain before and with a headache. I'm not sure about that. It could be a lot of different things, so that might be best to like discuss with an ENT. Someone was asking about vertigo and disequilibrium and the association with migraines or tension headaches. They're called vestibular migraine. So sometimes people don't actually get the pain with a migraine, but they get vertigo with their migraines. And I find that the vestibular migraines respond really, really well to the PRT type training, the pain reprocessing therapy. Someone's asking about headaches behind the eyes or mostly behind one eye. It could be a lot of things. So it could be like eye strain. It could be the occipital neuralgia. There's various things that could be. So again, that's kind of something to be discussed more with a doctor. So someone was saying that their MRI has shown white matter lesions, and is that common with migraine patients? Yeah, it is common to have some changes on an MRI with migraines, and they're usually benign. So usually doesn't really mean much as far like from what I've read. There's a couple different questions about like people's specific headaches and what I think they are, but I think without a full medical exam, I wouldn't be able to let you know. I'm sorry. Can you have a continual ocular migraine for months at a time that go up and down in severity? So I've heard some people in the migraine and headache world kind of argue about whether you can have a migraine for more than 24 or 48 hours. Having a continuous migraine for more than that period of time, a lot of people argue it's not a migraine, it's something else. But I've also heard people argue the opposite. So I think it's like still something that's under research. But I think if it's continual, then it begs more investigation. Someone asked about a silent migraine. I don't know what that is. I haven't heard that term before. Hmm. Someone asked about stimulators that are effective. I know that the trigeminal nerve stimulator Cephaly has a whole research team. So they're on their website. You can see a ton of research that they've done with that device in particular. So that could be definitely really helpful. Someone asked about something called the Perrin technique. I have not heard of that. Mm. Someone asked about neurologists that specialize in headaches that I would suggest. It depends where you are in the province. There's a headache clinic in the Lower Mainland. Oh, what is it called? I think it's called Neurologic. I've heard good things about them. Um, Are there eye stretches that could help? Yeah, so when our eyes are really tense, it can be useful to do something called the basic exercise. So you put your hands behind your head and hold the base of your head and then stretch your eyes to the left and hold for about a minute or two, and stretch your eyes up and hold for about a minute or two, stretch your eyes to the left or the right and hold for about a minute or two. That can be nice to give yourself that stretch all around the eyes. So, and then you get the added benefit of having like an open posture while you're doing it. This is interesting. So someone asked if I've worked with anyone who had non-epileptic seizures caused by the migraine. I have not had anyone that has had seizures caused by migraines. I have had people who have seizures caused by nervous system dysregulation type stuff or seizures caused by anxiety, but I haven't had specifically caused by migraines before. But I imagine that the treatment would be pretty similar in terms of turning down the sensitivity in the system. And then in terms of recommendations for functional medicine doctors, I'm not super well connected on the Lower Mainland anymore because I don't live there. So I'm not really sure who's still in practice or not. But looking into them and then looking into the reviews can sometimes help. And if you want someone that just makes a lot of good, like a lot of recommendations, there's Dr. Tellenbaum. He's in the States, but he has a whole website and he has a book called The Shine Protocol. He talks a lot about hormones in there. Can neurofeedback help with headaches and migraines? Yeah, for sure. Neurofeedback can certainly be useful, especially for reducing that sensitivity and for helping you with the meditation and things like that. We've got 3 minutes if anyone else has a question. I got through all of them. Anybody else have a question or comment?
Okay, well, thanks, Sarah. Another great presentation. And everybody keep an eye out for Dr. Denoa's presentation on migraines, medication, and Botox. Have a great week, everybody.
Perfect. Thank you so much. Have a great week. Take care.